So, Ori, I think we really ought to start. Forgive me. Ori, are you there?
I am. Just you. All right, friends. Welcome to the second webinar. Pluralism Legal Action Network and the American Association of Jewish Lawyers and Jurists. We are very fortunate to have with us today a good friend of the cause of religious freedom and equality in Israel, and a good friend of many of us and of Chidush, Rabbi Professor Elliot Dorff, Rector of the American Jewish University, Chair of the Halacha Committee, Law and Norms, Law and Standards Committee of the Rabbinical Assembly, and a world-renowned scholar and expert on Jewish bioethics, Jewish law and philosophy, and many other things. And this is a pre-Pesach webinar, and the title of our session this evening is "And Our Households Were Saved, Jewish Bioethics, Pesach, and the Health Considerations During the COVID-19 Pandemic." The way that we will go about this webinar is that it'll be led in a form of a conversation between Michael Chernick, Rabbi Professor Michael Chernick, YU graduate, Professor Emeritus of Rabbinic Literature at the Hebrew Union College, and the chair of Ruach Chidush, the Rabbis and Cantors for Religious Freedom and Equality, and our speaker, Rabbi Elliot Dorff. You will see the chat feature on the bottom of your screens, and you're welcome to write your questions, comments, and hopefully we'll manage to cover at least some of them. The session will be available afterwards, and we'll send you a link to the recording, as well as the resource page that Professor Dorff has prepared for us. So take it away, Michael Chernick and Elliot Dorff. Unmute yourselves and go ahead.
Well, the first thing I want to say by way of introduction is that working with Elliot has been really a pleasure. And the other thing that I would kind of add is that I think that while sometimes Jewish ethics and Western ethics are pretty much the same, in many instances they're not. And I think that we are going to get a very good sense of that in this discussion today. So, Elliot, I'd like to start with the question of how is Jewish medical ethics different from regular American bioethics?
Well, they begin with very different assumptions. American bioethics is part of the American ideology to begin with, which in turn comes from Western liberalism. We hold these truths to be self-evident, that all men are created equal, they're endowed by their creator with certain unalienable rights, and that among these are life, liberty, and the pursuit of happiness. That's Jefferson quoted that from John Locke, although Locke said life, liberty, and property, and Jefferson changed that. But as an American, I'm an individual with rights. So in American bioethics, the real issue is, what did the patient want? I've been on the ethics committee at UCLA Medical Center since the 1980s. And every once in a while, I say to them, you know, you didn't give to him what he wanted throughout the rest of his life. So why are you so concerned now? Right? So we laugh for a little while and then get back to the actual case. But that's the goal in American secular ethics. In the Jewish tradition, I'm not an individual with rights. The classic Jewish story is, of course, the one we're about to reenact on Seder night, the exodus from Egypt, Mount Sinai, and the trek to the Promised Land. We leave Egypt not as individuals, but as a community. And when we get to Sinai, we don't get a single right, we get 613 commandments. So that is, as I say, sometimes I do a lot of interfaith work. I say that sometimes that's the beginning of Jewish guilt, right? Although Catholics tell me that we don't know anything about guilt, they have it cornered. But the point is that but it also really sort of tells us that we are members of a community with duties, as opposed to an individual with rights. Now, sometimes rights and duties are reciprocal. So if you have a right not to be killed, then I have a duty not to kill you. But they're not always reciprocal. And certainly if I get up in the morning and I'm an individual with rights, then the world owes me. Whereas if I get up in the morning and I'm part of a community with duties, then I owe the world. It's a very different way of thinking about life. And when it comes to medicine, what that means is that the Jewish tradition has been much more interested in what we would commonly call public health issues than the American tradition, which certainly has a public health component to it. And now the public health component is front and center, because the question is, the question that a lot of hospitals are raising right now are triage issues, namely, if you can't save everybody, then whom do you save? So that public health issue, and then of course the fact that we're all quarantined, is very much a public health issue. It goes back to Leviticus 13 and 14, which also recognized that quarantine was a way of stopping communicable diseases. So the issue really for us is, how do you understand the nature of medicine in our own time under this pandemic? One other thing I think I would mention in terms of the difference between American secular ethics and Jewish secular ethics is that because I'm an individual with rights in American secular ethics, it goes some, you have to really go some in American ideology to say that I have to worry about somebody else's health, except to the extent that somebody else's health will affect my own. And so consequently, it's been really hard for for the United States to come up with any kind of socialized medicine, anything like that. I mean, there were pieces of it, Medicare and Medicaid back to the Johnson administration, and Obamacare, right? But still to this day, Americans pay far more for their health care than any other Western country, and we get much worse results. And it's part of that all comes out of this American environment of individualism. Whereas in the Jewish tradition, we really have responsibilities for each other. Back to things like Kol Yisrael Erevim Ze B'Ze. All Israelites are responsible for each other. And Ramban, Nachmanides already said in the 14th century, why do I have to worry about somebody else's healthcare? Because of V'ahavta l'reacha kamocha, love your neighbor as yourself, which he uses as the basis of the fact that I have to worry about other people, whether they be poor or in captivity or issues of healthcare. It's a much more communitarian understanding of my obligations as a member of a community toward others in all kinds of areas, including healthcare, than what we would get from an American understanding of things.
You've just talked about the differences between Jewish medical ethics and regular, quote unquote, American bioethics. What are the differing American and Jewish reasons why I should take care of my health with proper diet, hygiene, exercise, and sleep? Okay,
so in the American environment, the reason why I should do that, the reasons, there are many of them, are all pragmatic. I should do it because I will feel better. I will live longer. I will be able to get a job much more easily if I'm healthy, because then I won't be as much of a burden on my employer's healthcare system. I'll be able to do all kinds of things in life that I want to do that I wouldn't be able to do if I were ill. So it's all very pragmatic. And, that's not to say that those are not important reasons. They are important reasons as to why I should take care of myself. But in the Jewish tradition, it really is very different. And if on the source sheet, if you'll just take a, and part of the reason why it's different is because in the American understanding of things, I own my body. This goes back to the Nancy Cruzan decision of the US Supreme Court in 1990, where every individual, every adult, 18 or over, may refuse any medical intervention, according to the Supreme Court. That doesn't mean that you can require the government to give it to you. That right you don't have. But you do have a right to refuse any kind of medical intervention because you own your own body. So from an American point of view, if I wanted to, my Achilles heel, here we go. If I wanted to eat a half a gallon of ice cream every night of the week, and if so, it might as well be mint chocolate chip or Cherry Garcia. That stuff is so good. Anyway, if I wanted to eat a half a gallon of ice cream every night of the week, there's nothing in American law that would forbid me to do that. Now I'll gain 500 pounds in no time, and all of the bad pragmatic effects of doing that will be my lot. But nevertheless, the law does not forbid me from doing that. Whereas in Jewish law, I do not own my own body. God does. And as a result, I have a fiduciary relationship with God to take care of my body. And those are the kinds of things you get on the first part of the source sheet that I sent you. But if you would take a look at A4, this is one of my favorite pieces of the tradition.
Wait, which one?
A4. You see right in front of you, right? The first one says, right. That's right. Deuteronomy 10:14, beginning, mark the heavens to their uttermost reaches belong to the Lord your God, the earth and all that is on it. So we belong to God. Therefore, 2, I may not commit suicide. We'll get to that. Number 3, I have to be able to bathe, which in the ancient world was a real deal. Remember, this is long before germ theory. The germ theory doesn't come into medicine until the 19th century. But then this one from Maimonides. He who regulates his life in accordance with the laws of hygiene with the sole motive of maintaining a sound and vigorous physique. That's the American reason, right? And begetting children to do his work and labor for his benefit, good luck, is not following the right course. A man should aim to maintain physical health and vigor in order that his soul may be upright in a condition to know God. Whoever there throughout his life follows this course will be continually serving God, even while engaged in business and even during cohabitation, because his purpose in all that he does will be to satisfy his needs so as to have a sound body with which to serve God. That's a very different reason as to why I need to take care of my body. So in Jewish law, I do not have the right to eat the half a gallon of ice cream every night of the week, right? Because I have a fiduciary duty to God to take care of myself. Now, in the current pandemic, that translates to not only the pragmatic reasons why in American law I need to stay quarantined, namely the pragmatic reason that we don't want to spread the virus and therefore spread its effects, illness and death for some people, but rather that each and every one of us has an obligation to be able to serve God in this way when we need to be able to worry about the health of the community and not just my own health. So it's again, the end result may be the same. The end result may be I should not eat that ice cream, or that at least that amount of ice cream, right? And I should engage in proper exercise for whatever that is, for whatever age I am, whatever health condition I'm in, and hygiene and sleep. And by the way, Americans are the most sleep-deprived society in the world. You really do need about 8 hours of sleep a night, and it's and we Americans suffer for that in terms of blood pressure rates and all kinds of other issues that come with lack of sleep. So I need to try to do those things in the American environment, including preventive things like staying quarantined, because of the fact that I owe God this, so that I can be in a place where I can serve God, where I can do the mitzvot and serve God in other ways. the other way, I think, which is really important, is the thing that comes next. And in order to introduce that, I just want to, just because Jews tend to think that the whole world is Jewish and everybody thinks the way we do, on this issue in particular, the Jewish tradition really went in a very different direction than both the Western philosophical tradition and the Christian tradition. In Western philosophy, starting with Plato, there's a dichotomy between the mind and the body. The body is the animal in you, the mind is the distinctly human in you, and the mind should therefore rule the body, and the equivalent of that on a societal level, on a social level, is that the philosopher king should rule the rest of should rule the army and the mob. So it's a very, very sharp distinction between body and mind, and that continues on through the whole of Western thought. So the question then becomes, well, how are they related? Descartes thought that they were related through the pineal gland. It's a gland in your head, that was the magical place where the mind and the body are related. And still to this day, until very recently, especially in the middle of the 20th century, when doctors were trained, they were trained to see the body as the thing that they were dealing with. So if the body was not functioning well, their job was to fix the body. And that comes out of the sense that my only mission as a doctor is to deal with this body. So this body-mind dichotomy, I mean, yeah, that's right. It has had major effects on the way that medical care was taught in American medicine until very recently. The other, in the Christian tradition, there is also a dichotomy between body and soul. The body is, again, the animal in you. The soul is the divine in you. And so, especially in the Catholic tradition, the ideal person is the one who basically sequesters the body to the extent possible in order to cultivate the soul. That is the monk, the priest, the nun, right? Those become the ideal figures because those are the ones who basically try to minimize the use of the body in service of the soul. But in the Jewish tradition, that was not the case. And if you will, take a moment and read B1, the Talmud from Sanhedrin 91ab. Just take a moment to read it.
Or you may have to scroll down the text.
Okay. So the Holy One, Blessed One, brings the soul, throws it into the body. That's literally the Talmud's word, ramini, throws it into the body and judges them as one. Now, it's a simple story, but it flies in the face of everything that's in Western thought and in Christian thought, right? Where the body and the soul are integrated within us. The soul being the equivalent, the mind, the emotions, and the will, everything internal to us, right? So all of those things are totally within us. Now, why is that important? Because what it means is that when we're thinking about healthcare, and especially now during the pandemic, what we have to recognize is that the way we take care of our bodies affects how we think about ourselves, how we feel about ourselves, and what we want. And conversely, how we think about ourselves, how we feel about ourselves, and what we want in life is very much has a great effect on the way that we treat our bodies. That those things are integrated within us. I remember you may know that Rabbi Abraham Joshua Heschel gave a talk to the American Medical Association in the 1960s, I think it was, called "The Patient as a Person." And what he was saying to doctors at the time was that you have to recognize that the person in front of you is not just a body to be healed, so that you're not just a glorified mechanic, but rather you didn't use that term. That's my term. But but that what you have to recognize is that the person in front of you is a person, and that person's health care is going to be dependent upon all kinds of things that are not directly connected with the body. In the 1990s, I was a member of a curriculum committee at UCLA Medical School, and the people who had called it together were 2 senior professors at UCLA Medical School and 2 junior professors, as it happens, all 4 of them Jewish. And the point was, how do we educate doctors and doctors in training to understand all of the other non-physical issues that are involved in a person's care? And what we did was create a program called doctoring, which to this day is required of UCLA medical students all 4 years of medical school. And it was a series of cases in which the various non-physical aspects of medical care are illustrated. The anthropology of medicine, the sociology of medicine, the economics of medicine, religious issues, ethical issues, and so on, right? So the first case I remember was a 15-year-old female walks into your office complaining of stomach problems. You examine her and you find out that her stomach is fine, she's just pregnant. Now, it would be better from a strictly physical point of view if she were, say, 18, but if she's in otherwise good health and if she gets good prenatal care, she'll probably be fine from a physical point of view. But she is unmarried, Catholic, and Hispanic. And so all of those issues are going to have a major effect on what her health care is going to look like. So she's unmarried. Does that mean that she will be kicked out of the house? Well, probably not in the Hispanic community. If she were Irish Catholic, much more likely. She would have to go to a home for unwed mothers. But in the Hispanic community, probably not. She's Catholic, so is an abortion a possibility? Probably not, although you never know. I'm co-chair of the Priest-Rabbi Dialogue in Los Angeles and have been part of it since it started in 1973. And my priest friends say that the American church is understood in the rest of the Catholic world as the Pope's loyal opposition. But that notwithstanding, I think most certainly Hispanic Catholics in the United States would not consider an abortion. So let's say she's going to be home to gestate this baby. Is she going to give it up for adoption afterward? If not, then how is she going to care for it? Will she ever be able to finish high school? Who's going to support her during all of this time? Where's the guy in all of this, right? All of those kinds of things are things that the doctor at least needs to be aware of, because they will very much affect how often she's willing to come in for prenatal care, what kind of, who's going to be there for her when she delivers, what's going to happen to the baby after she delivers. All of those kinds of things are part and parcel of what it means to do medicine. Well, certainly in our own time with this pandemic, that becomes all the more important. Even those of us who are physically well are now experiencing what it's like to be incarcerated. You need to know that, I mean, one of the early verses in Genesis, it's not good for a person to be alone. That becomes really a rather, I think, front and center in terms of us. We all need some time alone, but we also have a very strong need of being in touch with others. Maybe not literally so in touch, but certainly in connection with others. Just one very graphic example of that is that in prison environments, short of execution and torture, the harshest penalty is solitary confinement. And we have, unfortunately, some very good evidence that people who are held in solitary confinement for long periods of time go insane. So we really do need to be in touch with other people. And what that means now for us in this pandemic is that you really, even if you have friends that you normally see in various kinds of environments that you're not seeing now, it's really important to call them, to FaceTime them, whatever it is that you do. Even if it's just to check in with each other, to share jokes, to talk about the things that you normally talk about. It's really important to do those things now and not be embarrassed about doing it. And it's something that, let me just say it straight out, that men have more difficulty doing this than women do. Women are more used to having long conversations on the telephone that are just for fun. And men are very more businesslike on the telephone. So it's a real cultural shift for a lot of men to be able to call their friends and call other people and just to talk. But in this pandemic, it really is important because your mental health and your need to have social contact is very much in evidence during something like a pandemic. And you shouldn't be embarrassed about that at all. Another thing that I think is really important here is that, and that, by the way, comes out of, if you'll scroll down a little bit, I'm going to skip number 3 here, but if you look at number 4, that one needs to visit people who are ill. And I mean, this was, Bikur Cholim is a mitzvah. I mean, we all sort of know that. But let me sort of say why it's a mitzvah, right? In number 4 here, from Sota 14, it's because it's a way that you imitate God. That just as God visited Abraham after his circumcision, so too you need to visit people who are ill or people who are hurting, whether that be physical or emotional or feeling isolated. And we all are hurting. I mean, it's not, we may not be in the category of sick, physically sick at the moment. Hopefully we'll survive this pandemic. But we really do have psychological needs and associational needs to be in touch with each other. And what the Talmud here indicates is that you're actually following God's lead when you visit the sick. And number 5, Rambam, visiting the sick is an obligation incumbent on everybody. As long as you don't burden people. So, you have a conversation and you sort of have to be aware of the fact when you need to stop. And then the question is, well, what do you talk about? Well, what I would say is that this is all part of this understanding of the human being as being an integrated whole. Our body, our mind, our emotions, our will are all integrated within us, and they affect each other. But we are also not individuals living on isolated islands. We are members of families. We are members of communities, and we need to be able to be in connection with those communities. So let me mention 4 things about illness that you need to know about. Number 1, it's isolating. And that's the reason why it is really important to do Bikur Cholim. In this case, call other people, FaceTime other people, whatever it is. And because people need to be in touch with each other. Second thing, it's infantilizing, right? So when, it's debilitating. That's the second one. So when you talk to people who really are sick, right, you need to understand that they may not be able to respond in the exact same way that they would be if they were well, but on the other hand, they may be able to. And so when you visit somebody in a hospital, sit down so that your body language does not indicate that you're in control and the person in the bed is not, because that kind of body language where you're upright and the person is supine, right? That body language says I'm well and you're not. So sit down, and I tell this to doctors all the time as well. Rambam actually lived in a time in which you did not have raised beds. People slept on mats or mattresses, and so Rambam actually says you have to lie down so that your head is not higher than the patient's head, so your body language does not give people a sense that does not reinforce their sense of disability. But then third, illness is infantilizing. You can't do the usual things that you normally do. So what do you talk about? Well, let me just tell you that people really tire of talking about the weather and the food in 3 seconds, right? So what do? You talk about the same adult topics that you would normally talk about if everybody were well. right? And that's true, by the way, when you visit people in a hospital, just as much as now when you're talking to people who are themselves physically well now, but are isolated and are therefore in big emotional needs for being in touch with other people. So if what you normally talk about is politics, talk about that. Books, movies, sports, although they're not allowed to sports these days, right? And whatever it is that you normally talk about that. I learned this the year after I finished rabbinical school, and I was finishing my doctorate at Columbia, and I was asked to do 3 sessions on Jewish theology for residents of the Jewish Home for the Aged. And the 2 social workers who had arranged this met with me first and explained to me certain things about the fact that when a person ages, body language changes. So one example of that was that in one of the sessions I was teaching, this is all in person at the home, a man who had been a dentist had his eyes closed for the entire session, and then he raised his hands and asked a question, which made it clear that he had heard everything that had gone on. So the fact that people have their eyes closed later on does not necessarily mean that they're sleeping. So they taught me things like that. And then I finally said to them, why of all things, and by the way, they had me select certain readings in in 3 topics in Jewish theology, and they Xerox, they Xerox them in bigger print, and these people were really prepared for class. Not that my regular students are not, but these people were really prepared for class. And so I said to these social workers, why of all things 3 things in Jewish theology, 3 sessions in Jewish theology? And they said to me, because these people are bored of playing bingo, right? Their bodies are not doing so well, but their minds are fine. Now, of course, if they're in the reverse, that's a whole other story. But in this case, their bodies were not doing well, but their minds were fine, and many of them were college educated, and they wanted to have mental stimulation, just the way we always do, right? And so I'm not suggesting that you talk about Jewish theology when you reach out and talk to your friends, but not that there's anything wrong with talking about that. I do a lot of that, but do what you're interested in, and talk about those kinds of things. So, and the 4th aspect of illness, it's isolating, it's debilitating, it's infantilizing, and it's boring. And now we really are experiencing that, especially when we're talking about long-term illness or long-term quarantine. One of the things that really has occurred to me during this period is that the blessing in the morning that we say, Matir Asurim, who frees the bound, which originally in the Talmud was what you said when you're able to sit up in bed. And if you've ever seen people who are confined to bed and cannot sit up, then you understand why that blessing really makes a lot of sense. And it's also used, of course, when people got out of prison or something like that. Well, Matir Asurim in our day really, I think, becomes much more poignant when we are all confined to our homes. And there was a webinar yesterday that the Rabbinical Assembly United Synagogue Masorti Movement put on, in which Rabbi Jonathan Wittenberg from London gave a talk in which he had said that we will understand slavery this year and redemption from slavery much more poignantly than we probably have in the past, because we're not literally enslaved, but we are we're not free to go about our business the way we usually go about our business, or to go to movies or theater or whatever enjoyments we like. So in that sense, we will understand going from slavery to freedom, and a wish to do that this Pesach, probably more than we ever have in the past. So those are, I think, aspects of the differences between the Jewish understanding of things and the American understanding of things. In the Jewish understanding of things, we are integrated wholes within ourselves, and we are also integrated in families and communities. And we really need to have all of those kinds of connections in order to feel good. And the only way that we can take care of our bodies is if indeed we feel reasonably good about ourselves. right? And because the way that that we feel about ourselves is also the way we treat our own bodies, and vice versa. The way we treat our bodies will affect how we feel about ourselves. So it's important for all of those reasons, because we have a fiduciary duty to God to take care of ourselves, both physically and emotionally and intellectually, and of course in terms of associationally with our families and friends in this time. One last thing on this, and then we'll move to the next topic. Unfortunately, as you have been reading, a lot of people are dying of this disease. And so it is really important, if you have not done this, to fill out an advance directive for healthcare. An advance directive for healthcare consists of two things. It consists of a proxy statement in which you say, if I cannot determine, if I'm not conscious, for example, right? And I cannot say to the doctors, I want this, but I don't want that. Then you appoint somebody, person A, to be your proxy, to be the one that makes the decisions for you. And then usually the proxy statement has that person's contact information. And then if person A at the time is either unable or unwilling to act as your proxy, then person B, and then if not person B, person C. So that's the proxy statement. And then the second part of the advance directive is called the living will sometimes, in which you express some of your desires. And all three of the major movements in American Judaism have created their own versions of advance directives. The Rabbinical Council of America has one. I'm pretty sure that Moshe Tendler was involved in it. And what it says basically is, I am an Orthodox Jew, please call my rabbi. That's okay, right? If that's your set of beliefs, okay? The conservative movement has one from the Rabbinical Assembly, and you can go online and to the Rabbinical Assembly, and you can just type in advance directive. It was written by Rabbi Aaron Mackler based upon two different approaches to end-of-life issues that were approved by the Committee on Jewish Law and Standards, one by Rabbi Avram Reisner, one by me. We agree on about 85% of the issues, disagree on about 15% of the issues. So in that particular advance directive takes you through about 10 scenarios that are fairly common in end-of-life care that people have to make decisions about, and ask you what decision would you want. Where we agree, the decisions are in block print. Where I would allow something that he would not, it's in italics. But both of those were approved by the Committee on Jewish Law and Standards. And so this is a way of observing Jewish law as a conservative Jew in your end-of-life care. And it's important, if you don't know what these interventions are, to get somebody who knows what they are to help you fill it out. So after my father-in-law died, and I had to help my mother-in-law make a very difficult decision of removing healthcare from him when there was no medical prognosis for any improvement whatsoever, and we were just battering him. I helped her fill out her own advance directive, and she said, well, I want everything. So I said, okay, Mom, let's go through it one by one. And I explained to her the first intervention and what that would involve. And she said, oh, I wouldn't want that. And then we went to the second one. She said, oh, I wouldn't want that. We went through all 10 of them. She didn't want a single one of them, right? So why did she say, I want everything? Because she didn't want to be abandoned. And that's a very serious and important concern. And so what we needed to do was to craft her advance directive in a way that she said that she was afraid of being abandoned, even though she doesn't want any of these interventions. And that's important to be able to say. So you need to get somebody who knows what these interventions are so that you can know whether you want them or not. And in the reform movement, Rabbi Richard Address, who I think is on this call, created an advance directive that is very much in keeping with reform ideology, where there's a grid on the vertical end. There's a whole series of interventions that one might have, and then across the top is, I don't want something like this. Richard, you can correct me here if I'm wrong. but something like, I don't want it, I don't want it, I probably don't want it, I don't know, I probably want it, I want it. And then you just simply go through the grid and you check these things. And this is very much in tune with reform ideology, which emphasizes individual choice, individual autonomy, right? And then there are also advanced directives that every medical association, California Medical Association has one, I'm sure every state's medical association has them. But in any case, it's important to fill those out, just in case, right? As the Shulchan Aruch says, we hope you live to 120, but just in case, you should fill this out. And then one other thing that I think is really important in this, because this disease can be lethal, it is really important to share expressions of love for your family and for others. And again, here, I think men are less good at this than women are, but it's really important to share those feelings. The last thing that you want is that you die without ever being able to express your feelings of love for other members of your family, and vice versa, right? It's important for young people also to be able to express those feelings. And don't be embarrassed by this. I mean, that's the Anglo-Saxon stiff upper lip stuff. That's not really Jewish. What you need to be able to do is to express your emotions and to, even if you're not, even if normally you don't do that very often, especially in this kind of pandemic, this is really important to be able to say things to each other that may be the last time you're going to be able to say them, God forbid, right? But still, may be the last time you're going to be able to say this to members of your family or your friends. And it's important to articulate that, both for your own sense of completion and for theirs. And again, may you live to 120, right? But it doesn't hurt, by the way, without this pandemic, it doesn't hurt to say those things to people you love, every once in a while at least. But this would be a golden opportunity to do those kinds of things. Okay, Michael, you're on.
I'm sure there are a lot of people out there who are suffering already from coronavirus. Some of them only slightly, but others quite seriously, either in pain or hospitalized, and are asking the theological question, why me?
Yeah.
And I wonder whether you would want to say a few words about what the Jewish tradition teaches us about illness and how to respond to it. Because I know that there are a lot of people that sometimes think that if they're sick, there must have been some sin that they committed, or if this is a general pandemic, then there must be some big sin that the whole world has committed. And I really think that either we should disabuse everybody of that or convince them that they better be doing tshuva.
Well, I would go for the former. I think we should disabuse people of that, right? Illness is this kind of illness in particular is not something that anybody brought upon him or herself. There are illnesses that you increase your chances of getting if you smoke, for example, right? Or if you abuse alcohol or drugs, right? I mean, there are illnesses that you do have a role in bringing upon yourself, but this is clearly not one of them. And it's completely random as to who gets it, and on how people respond to it are functions of things that we don't even really understand yet, at least as far as when I've been reading some of the medical literature lately, and doctors don't really know what it is, except that the people who have the most serious forms of this disease tend to be 65 or older, with conditions that make it worse, in particular lung conditions like asthma or COPD, because a lot of the ways in which people are dying now are because of inability to breathe. That's the reason why ventilators are so scarce these days. So by and large, We do know that is the case. Again, completely, we don't know why. We don't know but completely on an epidemiological level, men are suffering from this more than women are, and are dying more than women are. We don't know why. And a lot of this is we don't know, okay? But it's certainly not a connection between sin and illness. It's certainly not that. And I think what the tradition would say is that, when you say, why me? There's no good, let me just say, that's the wrong answer. I mean, that's the wrong question to begin with. There's an evangelical preacher in Orange County, Saddleback Community Church, Rick Warren, who, by the way, is a real Ohev Yisrael, who wrote this book called The Purpose-Driven Life. And the very first line of it is, it's not about you. And that, I think, is a really important lesson for us as well. If you're suffering, then of course you're gonna feel bad and you're gonna ask those kinds of questions. But certainly with this pandemic, it's not something that you did wrong. It's not a sin that you did. It's not something that God attacking you over somebody else. It's just not the way it works. And what the question really raises, though, is a deep theological question that I would love to talk about on some other occasion if you want. But it's the problem of evil. Why do bad things happen to good people or good things happen to bad? By the way, the other part of the question is one that is rarely raised, but it also is very much part of the question of God's justice. Just as much as we ultimately say, why do bad things happen to good people? We also have to ask, why do good things happen to bad people? That's as much a part of the question of the problem of evil in theology as the first part of it. But I think it doesn't help. Let me just say it straight out. As one who loves philosophy, it doesn't really help to get involved in that set of questions at this time. Just understand it to be a pandemic that some of us get sick over and some of us do not. Some of us get very ill from this virus. Some of us much less so. And I think the ultimate Jewish answer to all of this is follow what the public health authorities are saying. You really do need to isolate yourself socially to be able to protect yourself and to protect the society, because you don't want to be one of those people that's going to have to overburden the emergency room in your local hospital, right? And the best way to make sure that that doesn't happen is that you don't get the disease. And the best way to make sure that you don't get the disease is to isolate yourself. So you have a really deep Jewish communal ideal here. Now remember, this is you're part of a community with duties. You have a very deep Jewish duty here to follow the instructions of the public health officials, isolate yourself so hopefully you won't have to be in a hospital, and do the things that you need to do in order to be able to sustain that emotionally as well as physically.
This year is going to be pretty tough on families. We know that the Pesach is a time when families get together and enjoy Sedarim with children, grandchildren, and extended groups of people that include their friends. And the Seder is going to be something completely different this year for most people. What do you think one can do for a Seder this year, which is going to be completely unlike any Seder of any other year? It's almost a
You're not kidding. Right.
Well, why is this year different from all other years?
That's right. You got it. You don't even have to ask the question this year. We sort of know right away. And the answers that are in the Haggadah are not the only answers we would give this year as to how this night is different from all others. Well, I mean, I think a lot of us are going to be engaging in Zoom starim. I just hope that there's enough bandwidth on Zoom to sustain all of these starim Wednesday night and Thursday night.
Just as a comment, there are millions and millions of school children who are on Zoom now, and nothing bad has happened.
That's correct. That's what my wife told me too. She said, like, everything from elementary school through high school, through college, through graduate school has been on Zoom for the last two or 3 weeks. So if Zoom could sustain that, then presumably Zoom could sustain the Jewish population of America. I hope she's right. But the thing is that it's and that's going to require, on the one hand, it's going to be really strange because we're used to being in the same room with a lot of family and friends, and that's part of the real joy of the Passover Seder. The other side of it is that I live in Los Angeles. 2 of our 4 children live around the corner from each other, 6 blocks from us, but our other 2 children live on the East Coast. And so this time, and for the first time in a long time, they're going to be part of our Seder. And let me just say that this is going to be stretching all kinds of rules in terms of when the Seder begins and what you do before sunset. And it's going to be so that, I mean, we're starting at 5:30 here, which will be 8:30 on the East Coast, which is probably okay in terms of when they say Kiddush. Not okay really when we do it here, but it was the only way to be able to have this cross-continental Seder. And it'll require a lot of creativity, so that to make sure that people of all ages are involved in the Seder. You're going to have to figure out what Haggadah you're going to be using, the kinds of things that you might do. My wife is an educator, and every year she creates some kind of game for the grandchildren. So this time it's going to have to be a game that one can do online, or that one can do in Zoom, right? I mean, we don't write things or draw things or anything like that. But she on Pesach, but she created various kinds of games that we can do, and so you're gonna have to be somewhat creative about that. But I think the important thing is to have the Seder on Zoom, whatever that means in terms of your own personal practice on electricity, on all kinds of other stuff, right? But I think really, as the Sephardic rabbis the 14 Sephardic rabbis in Israel said, that there really is a deep psychological need for us to be in touch with each other. So I think it is a time for some leniencies. It is Sha'at Adchak, if I've ever seen one. It is a time of emergency. And so those kinds of leniencies, I think, are in order. I have been as chair of the law committee, the Committee on Jewish Law and Standards of the Conservative Movement. That is the committee, has been asked all kinds of questions. And you can find those answers, by the way, on the Rabbinical Assembly website. You just Google Rabbinical Assembly and then look for, it's called CJLS, Committee on Jewish Law and Standards Guidelines. And you will also find on the Rabbinical website, the public part of it, all kinds of ideas about what to do with the starim and things like that. I'm sure the Reform movement has resources like that. I would imagine the Orthodox community does as well. But take advantage of those things that are online to try to figure out how you're going to deal with having a meaningful Seder this year, and doing it with family and friends to the extent that you can by Zoom.
I'd like to go back to something that you said earlier, namely that there is a body-mind connection. And the truth of the matter is that for so many people who will not be able to enjoy a Seder with members of their family, truth of the matter is sometimes the amount of anxiety that is invoking even now, and the amount of depression that some people are feeling, or sadness that they are feeling about the loss of that. If you ask me, once it really hits on Tuesday night, on Wednesday night, you're going to be dealing with people that are in the halachic category of cholim she'ein bahem takana.
Right.
They're going to be sick, but they're not necessarily in danger. And yet there are halachic possibilities for people in that situation that are very extensive. So that's just something to throw into the mix here. But
That's
the
right.
last of the issues that I would like to take into consideration is anybody that's been going to their grocery store, whether it's kosher or whether it's a large grocery store like the ShopRites that we have here, or the Costco's. I've noticed that there are plenty of lacks on the shelves. I can tell you that one of the worst pieces of news that the Jewish community got that is observing kashrut is that the Empire Chicken, kosher chicken factory closed itself down because of the coronavirus. And I'm really raising the question of what should you do if Passover provisions run out or cannot be gotten by any means? What do you do then?
So you do what you can. I mean, that's really what it boils down to. So what it means is that it depends what you can't get, right? So if it's chicken that you can't get and you normally would have chicken, so have something else. I'm a pescatarian, so I haven't had meat in a long, long time, but so I won't miss that.
So I don't know what to do with basil.
Yeah, understood. My wife is a meat eater, so I mean, I really do understand that. But all kidding aside, I mean, you really do what you can. You try to make it as festive as you can. Of course, people's tastes differ as well. So what kinds of things are really that you really love to eat? If it's at all possible to make them kosher for Passover, then do that. And there are all kinds of recipes that are online for flourless cakes and things like that. I don't know what happens with you, but I tend to gain weight during Passover because of all the sweets and all of that kind of stuff. I told you my Achilles heel is ice cream, so my wife actually makes cartons of ice cream that are kosher for Passover. We have an ice cream maker, which we use only for Passover. So I'm already worried about gaining 10 pounds this Passover, but I will try to resist and try to. I mean, remember that the mitzvah for matzah is only a kazayit, right? It's only a very small amount of matzah that you have to eat in order to fulfill the obligation. So if matzah is not kosher Passover matzah, you only have one box, but normally you would eat 5 or 6 of them. So just be very sparing for the Passover Seder. And then whatever is left over, you'll use for matzah brai or whatever else you use matzah for during the course of Passover. Do what you can in terms of buying ahead of time things that don't need a kosher Passover. Now this, by the way, will vary from rabbi to rabbi. So here I am. I'm just, if your practice is different, then it'll be different. But buying milk ahead of time, buy unflavored cottage cheese ahead of time, buy unflavored yogurt ahead of time, buy eggs ahead of time if you can. Now again, in Los Angeles also, there are a lot of empty shelves on the supermarket stores. And you can't use their delivery service. They just don't have any time that they're delivering. Instacart also doesn't work. I mean, all of these kinds of things that don't work. And in our case, my daughter and my son who live in town are doing our grocery shopping for us. And, we have a list and they get whatever they can. And we'll feel Passover the way our ancestors did, more poignantly on that issue as well. I mean, we won't be able to have all of the Passover good foods that we're used to. But let me just tell you a story about that. When we first moved to Los Angeles, my wife was doing her first Passover buying, and there were multiple things. And the checkout lady said to her, she was clearly an evangelical Christian, she said, "Is this for Passover?" And my wife said, "Yes." And she said, "But the Israelites didn't have all of this food when they left Egypt." So, think about that when you think about what you're being deprived of this Passover.
Michael, to give you a chance to look at the questions that our participants have posted, let me just ask Elliot a question that Richard Edris raised, and you mentioned Richard. He's asking if you could speak about the Polst forms.
About?
The POLST, whatever that is.
Oh, yes, thank you. And it started in California, and now I think most states have it. POLST is the Physician's Orders for Life-Sustaining Treatment. In California, it's a pink document that you put on your refrigerator. So if EMTs come, emergency medical technicians come to your house, if you call 911, then until the advent of these POLST documents, all other advanced directives that you filled out would be null and void. They were required to try to save your life no matter what. But now, if you really want your decisions about life-sustaining treatment to be enacted by the emergency medical technician, then have your doctor, your primary care doctor, fill out a POST, Physician's Orders for Life-Sustaining Treatment, in which the doctor says what should be done and what should not be done. And in California, as I said, it's a pink piece of paper that gets put on your refrigerator door so that they know exactly where to look. I don't know what it is in other states. And that you need to do that as well as fill out an advance directive. Thank you, Richard, for mentioning that.
Michael, have you managed to look at the questions people raised?
Actually, no. I've been concentrating on
All right. So you review that, and in the meantime, I'll ask Bruce Kahn's question. He says, "Click on the Jewish rationalization of ultra-Orthodox community members who shun science and rules health experts decide. This is one of those times when it is difficult to understand one another as Jews, tendencies to get angry about it and embarrassed." So that is a sort of a specific question, but can you reflect on what's happening with the ultra-Orthodox Jewish community with regard to the COVID-19 as we see it unfolding very painfully, tragically, both in New York and in Israel?
Well, I have to give you one background piece of this. I'm a pluralist, right? I am a committed conservative Jew. I've thought a lot about this. I've actually written 2 books about conservative Judaism, right? So I am a committed conservative Jew, but I am also very happy that Jews can tie into our tradition in multiple ways. I think that's part of the richness of our tradition, and I'm really glad that people can find their roots and their meaning and their hopes and find intellectual stimulation and spiritual things, all kinds of stuff. I'm really glad that we have this really rich tradition that people can connect to in multiple ways. So normally I'm a pluralist, even though I am a committed conservative Jew. On this issue, I just have to say, I think they're crazy. And aside from that, I think that they're doing something which is deeply un-Jewish. And all the ways that I've just been talking about, that they have to worry about the health of the community, and if anything, the Jewish tradition has had a love affair with medicine for at least the last 2,000 years. Yes, there is that Mishnah that says the best of physicians should go to hell, but that was based upon the fact that in times of the Mishnah, people looked to doctors to really be able to cure their diseases, and they weren't able to do that. So at least I read that Mishnah as an expression of frustration on people's parts. But all kinds of rabbis who were physicians through the last 2,000 years, not just Maimonides, a lot of them. It doesn't happen very often anymore because rabbinical school still takes more or less the same amount of time, but it takes much, much longer to become a physician. I was at a conference at the University of Virginia Medical School where the dean said, in Mr. Jefferson's medical school, to become a doctor took 1 year. Right now, it's a whole different thing. So there are not a lot of MD rabbis. but there aren't as many as there were in the past. So our tradition is very much interested in what medical science tells us. And the ultra-Orthodox have the same fiduciary responsibility to take care of their bodies and to take care of their communities as much as all the rest of us Jews have. So I think what they're doing is deeply un-Jewish, aside from being medically crazy. And I think we have to call them out on it. I think we have to say, look, you have a right to observe the Jewish tradition in your own way, up to the point, and not beyond the point, where you are endangering the lives of everybody. You don't have that right. Quite the opposite. You have the obligation to save lives, and the way you save lives is not by having weddings and public weddings and funerals and yeshiva sessions and all of that. The way you save lives is by agreeing to be quarantined, the way the rest of us are.
I'm actually writing something to highlight a different dimension of the issue, and that is the writings that are coming from reliable, figures in the Haredi community suggesting that the pandemic is God's agent. But that's, of course, a very different issue. Right. But another question that may differentiate general bioethics and Jewish bioethics, or maybe not, that we were asked is, could you speak about the triage concept and how does the Jewish tradition deal with it?
Okay. Just make sure that everybody is on the same page. The word triage comes from the military context. And it basically is where you have a number of people who are wounded on the battlefield. And the question is, you can't save them all. So which ones do you save? And what comes out of the military context is you save the ones that have the greatest chance of surviving and then being able to rejoin the battle. So it's very utilitarian in that way, right? Which is the normal triage way of understanding military combat. It comes into the medical context in terms of when you don't have enough resources to save everybody, then whom do you save? And that issue has, thankfully, in the American environment, has not been one that the American medical establishment has had to face very often, but it has to face it now front and center. I've been on the ethics committee at UCLA Medical Center since the 1980s, and over the last week and a half, we've had 3 meetings by Zoom, of course, for 2 hours each, in terms of creating the triage policy at UCLA Medical Center. Unfortunately, I've been asked this, unfortunately, there is not a national triage policy that comes out of either the federal government, like the National Institute of Health or something in that order. I've been on 3 federal commissions on issues in medical care. Not a single one of them was on triage policies. And so as far as I know, there has never been such a commission to even recommend triage policy, a particular triage policy to the rest of America. And so every hospital is doing it on its own. After that, I tried to create what I construe to be a Jewish understanding of triage. And that is also on the Rabbinical Assembly website, if you're interested in that. And Rabbi Daniel Nevins, a good friend, and understands triage in our time from a Jewish perspective in a somewhat different way. And so both of those essays about triage are on the Rabbinical Assembly website. The ultimate difference between us is that what I use, this comes out, well, let me step back one time, one moment. In the book that I wrote called Matters of Life and Death, A Jewish Approach to Modern Medical Ethics, back in 1998, in chapter 12 of that book, I talk about the distribution of healthcare. And one piece of that is who gets it, and another piece of it is who pays for it. And in that book, I already mentioned the fact that until the 20th century, scarcity was not experienced in the Jewish in Jewish society over medical issues. It was because until the 20th century, preventive medicine was pretty good, like quarantine already in the Torah. And the rabbis already say you shouldn't eat too much meat and you should have fruits and vegetables. I mean, they're aware of some of these medical ways of preventing illness. But curative medicine was terrible. The only thing that people could do until the 20th century was surgery. But if they cut off part of your body, you probably bled out and died of that, or you got infected and you died of that. And the other thing was that they assumed that, rightly by the way, that a lot of diseases are bloodborne, so they would do bloodletting, right? They would take a pint of blood. But the problem is that that works only for one disease. It happens to be a disease that my mother had, polycythemia, too many red blood corpuscles. And there, still to this day, the cure to it is you take a pint of blood every once in a while. But it doesn't work for anything else. And it wasn't until the sulfa drugs in the early 20th century and then antibiotics that medicine was able to do really curative things effectively. So the scarcity that the Jewish societies faced was in poverty, among the poor, who should get what, and then also in redemption from captivity, which unfortunately our people had to deal with a lot of times during, in many places and times. And so in that book, chapter 12, I talk about the triage that comes out of a source that is repeated 3 times, all in Israeli things. It's in the Tosefta, in Tmurah, it's in the Jerusalem Talmud, and it's in Breshit Rabbah. And basically, it's the story about what happens if an enemy surrounds a city and says, either give us one of your number or we will kill you all. And then, if that's the case, then they're not allowed to give up one of their number. But if the enemy says, give us so-and-so, then you may, and actually must, give up so-and-so in order to save the rest. So there's a sense that if the enemy is the one that's causing the death of a particular person, and the enemy picks that person out, then that person can be, and actually should be, surrendered so that the rest can live. Now, and in that book, I already say then, this is 1998, that if you see this as death as the enemy, and if the enemy singles out a particular person as being not able to survive, then you not only may, but really should, sacrifice that person for the sake of those that you can save. That said, the usual exemptions apply, right? In other words, there should not be a matter of gender, of race, of ethnic background, of religious background, of ability to pay, or age, except to the extent that age affects who has a decent chance of survival and who not. And so that I use that source as the basis of my Jewish approach to triage. What that means, of course, unfortunately, and this is what I call the tragedy of triage, what that means is that some people who would ordinarily continue to be on life support systems, because we have plenty of them, right, will be detached from them in favor of people who have a greater ability to, or at least are diagnosed with a greater ability to survive to hospital discharge. I'm not talking about to survive to 120. I'm talking, because that would be straight utilitarianism. Straight utilitarianism would be, you don't save the most number of lives that you can, you save the greatest number of life years that you can. That would be straight utilitarianism, and that would mean that you would privilege the young over the old. But that's not what I'm saying. What I'm saying is you save the largest number of lives that you can save, whatever their ability or disability, whatever their age, whatever, again, their gender, their ethnic ability, their ethnic origin, their socioeconomic status, all of that. Rabbi Nevins can't swallow that. And I really do understand that, because by and large, I don't want to swallow that either. And so the major difference between us is that he would never detach somebody from a life support system that they were already attached to. Whereas I would say that that's fine in normal clinical medicine. But the whole point of triage is that we're in shat hadchat, that we're in an emergency situation. And we really do need to have what I call a paradigm shift. That's what philosophers call this, where you go from clinical medicine to public health concerns, right? Now, by and large, clinical medicine and public health reinforce each other, right? So public health things like vaccinations and public health education, don't smoke, don't become obese, don't abuse drugs and alcohol, don't, those kinds of public health interventions, right, normally are very much in tune with clinical medicine and very much support it. In this particular kind of tragic case, where triage is necessary, you can't just operate the way that Rabbi Nevins wants to operate, as much as I love him and would love to be able to say the same thing. But I just don't think it's realistic. But that's a dispute among friends, and I really mean this. We're very good friends, and I have tremendous respect for him, both as a person and as a scholar. But you will be able to see the differences between us on the Rabbinical Assembly website. Just look for triage there, right? CJLS triage, and you'll see the two opinions.
Well, we'll send you the link to the committee's materials to make it easier for you. Michael, we have a challenge here. We have sort of outrun our time, but I'm getting messages that you are just fantastic, Elliot. So what I suggest is that we have already lost a few who had other appointments or engagements. And Michael, what I suggest is people who need to leave should leave and maybe just pick up 2 questions from what you have already reviewed and present them to Elliot, and we'll call it a night here in Jerusalem.
Okay.
Michael?
I'm looking at the questions.
All right.
We're getting a lot of thanks,
Okay, thank you.
which is a good thing.
The questions are earlier on.
I know that.
Yeah. So in the meantime, Elliot, you reported on Rabbi Nevin's reluctance to detach somebody from a respirator. We have more experience here. There have been instances in which our Minister of Health, Rabbi Litzman, prevented detaching a person from a respirator even after the person was dead. Because one of the things they refuse to accept is brain death.
Yes.
So as long as the respirator replicates signs of life, it shouldn't be detached. And actually, that was something that came up recently in Israel, because apparently there are quite a number of people, and the exact number is not known, who are kept on respirators in hospitals for long periods of time, indicating that there may be instances of brain death among them. And now, with the concern that there may not be respirators, the issue, of course, came up.
Yes.
But that's not a question.
Okay, go ahead.
Did you find? I don't see among the various questions that I've asked. I think Elliot has covered, I would say, the majority, if not all, of the questions that have been asked in one way or another. I'm a little bit concerned about the question that's been raised regarding the Haredi community. I was very appreciative of Elliot's response about pluralism. Truth of the matter is that the Haredi community is a divided community. And sectors of it have managed to survive this and not be affected by it in the same way as other sectors of it have been. I would have to say that pretty early on, there were some Hasidic rabbis who had a sense that this was not going to be a small matter and immediately demanded of their followers to go into various varieties of quarantine, masking, this, that, and the next thing. And it was those communities that at this point are not as evolved. If you take a community like B'nai Brak, where 4,500 elderly people had to be moved out of the community because they were all sick, or Lakewood, which has in the States, where you have well over 600 people who are ill, including my Haredi cousin's children. That's because they refused to close down the yeshivot because bitul Torah, the voiding of Talmud Torah, was a worse thing than getting a coronavirus. Or you'll be protected if you're going to sit there and study, because Torah Megina al Lomdea, the Torah is going to protect those who study it. But I would have to say that the cut down or the divide between the Hasidic community and the Yeshivish or Misnagdic community is an interesting one. It doesn't play out in places like Borough Park, where everybody is with everybody. It doesn't play out in places like Williamsburg, where Satmar was very, very unwilling to go along with any of the protections. But there were certain other groups that were much more interested in saving their communities, where their communities are doing much better than I would even say Teaneck right now. I'm saying in a community.
Good for them. Absolutely.
In a community this minute that has 420 cases, 21 cases yesterday. Of those people, of those 421, they're only reporting the ones that are in the hospital. My neighboring town has another 250. So if you're going to add all together what's being dumped into Englewood Hospital, Hollywood Hospital, or Hackensack Hospital, they're being overwhelmed at this minute.
Yes.
And I would say we're dealing with a modern Orthodox Jewish community. So, it's.
I actually have a problem, Michael and Elliot. And the problem is that when we have to talk about a Jewish and democratic state of Israel that has to deal with this issue. And I had actually written a question. I don't know if you saw it. I wrote a question saying, Elliot, you are a consultant to the state of Israel. You were advising the prime minister and the Knesset of the state of Israel. What would you advise?
I would advise exactly what's going on now, at least in California. I can't speak for anywhere else, which is that everybody is mandated to, for social distancing. Actually now, the mayor of Los Angeles, a Jewish fellow, very, very actively Jewish fellow, Mayor Garcetti, was on television 2 days ago saying everybody should wear masks, and he was wearing a mask. When you go out for necessary things, like grocery store or whatever, or even if you go out for a walk, and it's and I think that triage policies have to be devised very carefully so that what resources exist are decided upon, their distribution is decided upon in a public way. I think it's unfair to doctors to have to make the decision on the spot. And this needs to be done, I didn't mention this before, but this needs to be done by somebody by a triage officer or a triage committee within the hospital, who is different from the doctor on scene, because the doctor on scene has a duty to help the patient in front of him or her, right? Whereas in order for triage to be done in any kind of fair way, it's got to be done by the enemy, right? It has to be done by somebody outside who recognizes the shortage of provisions. And one of the other things I said in mine, and I think Danny said in his as well, Rabbi Nevitz said in his as well, is that this triage stuff these triage protocols should apply only during the time of Shad HaChak, only during the time of this pandemic. As soon as we're able to get out of this and we can return to normal medical care, then we should do that.
Thank you.
All right, friends. We have been really privileged to be with and study from a great scholar, rabbi, and as I said, a wonderful friend of Chidush, Elliot Dorff. And thank you, Michael Chernik, for moderating, for having that conversation with Elliot. The silver lining of this pandemic, and it's obviously not something we would have wished for, but with the pandemic so horrific, we should be grateful, is really this online option, which enables you, Elliot, for the first time in many years, as you said, to have a Seder, a Pesach Seder with your East Coast family,
Right.
and enables all of us to enrich ourselves with teachers like Elliot. This is the time to mention that on April 28th, we'll have the next webinar, bringing us closer to two of the four co-sponsors, namely the American Association of Jewish Lawyers and Jurists and the Jewish Legal Pluralism Legal Action Network. And we'll have Professor Rivka Weil from the IDC, a constitutional law scholar, again, highly regarded throughout the world and taught in all the leading universities. And she'll be speaking about the threats to Israeli democracy that have unfolded in recent times. And we still are not clear. Today it's been announced that the rivaling parties have come to an agreement and the coalition is imminent. But with this imminent coalition, I should inform you, we would all have grave concerns because all promises and hopes for greater religious freedom and equality are going to be buried by the coalition partners, which means our efforts and advocacy is going to be required for a while longer. And of course, your support would be appreciated. Now, as Gordon knows, often the question asked last is really a good segue to a future program because it really deserves a special focus and elaborate discussion. So we will find an opportunity soon to schedule a webinar that will focus on the situation in Israel and some of its Jewish legal rabbinic ramifications. Just on the screen now, I saw showing the news in Israel now, the night news, evening news, and the police have been arresting worshippers who still defy the discipline that the authorities require. But having said that, I think that Michael is right. And for the clear majority of the community, both Hasidic and Lithuanian, the realization of the pandemic has settled and they understand that we are all in trouble and they are seeking help and are abiding by the guidelines and facing challenges. So we'll be discussing that further. I want to thank again Michael and Elliot. Thank all of you for joining us. We'll be sending you a link to the recording of this session, Elliot's selection of sources, and a link to the committee's materials. I hope we'll see you all and be able to discuss the other side of that coin, namely the legal aspects or the legal related aspects of the threats to democracy arising from both the pandemic and the political situation in Israel. And in the meantime, Pesach, meaningful, as sameach as possible, as meaningful as possible, and enjoy the expanded family that Zoom enables you to, and settle for the physical confines, which give us a whole new sense of what avdut in the very contemporary sense of the word may instruct us and may sensitize us to. So, Shalom, Chag Sameach, Todah to you all.
And when you go to the section of the Seder that talks about the 5 rabbis that were B'nai Brak, just remember that the policeman came and broke the
Right. Okay. Bye-bye now.
Shalom.
Shabbat
Thank you so much. This was a wonderful program. Thank you.
Our pleasure. Thank you.
Thank you.